Well, hello, doctor. I want us to take time to review one very key MCCQE1 objective. And these series of highlights are to help you to know how to design your study. So let's get right into it and um, get to the bottom of this presentation. So today, I want us to review a very important one. I want us to throw some light on this very important MCCQE1 objective. And I want us to pick on objective 53. 53. And it is the objective entitled non-articular musculoskeletal pain. Because under that objective, there are a lot of topics, and I want to pick on necrotizing fasciitis so that you can use this as a study guide for this very important MCCQE1 objective. So if you are planning on studying this particular objective, what should your strategy be? Basically, first, I want you to pay attention. So just put off every phone, YouTube, everything. It's just going to be a very short period of study. Let's just put everything aside. Let's pay attention. Put your phone on silence. I need your full attention so that we can get this thing going. Everything, Facebook, just put it aside and let's get right into it. So, necrotizing fasciitis, now that I have your attention, necrotizing fasciitis, it's a very important topic and it's found in the MCC objective. And what should the approach be? So, point one is that the candidate will be able to further classify the likely underlying pathology and determine if urgent action is required. And with necrotizing fasciitis, sure, urgent action is required. You don't need to play around with this particular condition because it can progress very quickly. So in a situation like this, whether it's in your CDM or in the MCQ, you have to attack it with all seriousness, all urgency. And that's what I'm trying to point at. And another point this objective wants you to know is list and interpret critical clinical findings. Critical clinical findings. Remember, critical clinical findings are quite different from lab investigations. So when somebody has necrotizing fasciitis, what will you recognize? You recognize crepitus. You'll also recognize some gas on imaging, and the gas is what will give you the crepitus. You may note some hemorrhagic bullae as well. So you want to note that as well. At times, if there is some fluid coming out, people describe it as dirty fluid or dishwasher fluid, okay? And usually, if you should touch it, you realize that the patient is experiencing pain out of proportion. So you go like, this is a very benign thing, but the patient is in a lot of pain. And the patient may have fever, tachycardia, and hypotension. So you realize that the vital signs are very important: fever, tachycardia, hypotension, and then pain out of proportion and a kind of fluid which is coming out, as well as are there any bullae on there. Now, the next point you also want to look at is list and interpret critical investigations, including appropriate investigations and other tests. So the appropriate investigations you want to look out for: WBC count, because definitely it may be elevated. Lactic acid levels should be high as well. Sodium levels should be low. And you may also realize that CK levels will also be elevated. So that is also another point you want to pay attention to. And you also have to know how to construct an effective management plan. And like every emergency case, you need to make sure that the patient's airway is stable, breathing is stable, circulation is stable, okay? For necrotizing fasciitis, you want to make sure that fluid resuscitation is very important. So you want to make sure IV lines are passed, the patient is getting bolus fluid so far as the patient is not overloaded with fluids, and broad spectrum antibiotics. So the broad spectrum antibiotics, you want to use an antibiotic like clindamycin. And you use clindamycin because it helps to prevent toxin formation. And you also want to include other antibiotics like peptides or what you call piperacillin tazobactam, vancomycin as well. And remember that one of the main objectives, they want to know whether you want to refer this patient urgently. So after you've made sure airway, breathing, and circulation is good, fluid resuscitation is good, started your broad spectrum antibiotic, this patient needs to go see a surgeon quickly. It could be a general surgeon or a plastic surgeon quickly, just so that they can deal with it. And then one last thing I want to draw attention to with this particular topic is what imaging investigation to request. Usually, necrotizing fasciitis is, a clinical diagnosis. But if you want to choose one investigation to do, it is CT scan. The CT scan will help you to see if there's any underlying, abscesses or anything. And this particular CT scan, I want us to pay attention to it. It is showing air under the skin. So this is what will give you the crepitus feeling, okay? So this is a very quick review of necrotizing fasciitis and this very important MCCQ topic. Let's, all the best in your exam. Good luck. Keep a positive mind, only positive vibes, stay away from all forms of negativity and enjoy your positive life, okay? All the best, doctors.